Have you noticed your gums been bleeding recently? Or is your significant other telling you that there's a bad smell coming from your mouth? I'm Dr. Lopez, and in today's video we're gonna talk about why. Okay, so let's talk about this a little bit more. If this is happening to you, more than likely you're experiencing something that is called gum disease, but it can also be named as periodontal disease, which is just a big word to say that you have infection around your teeth. Now, what are the most common causes of gum disease? Obviously, brushing your teeth, keeping them nice and healthy is one of the most important things that you can do to avoid from happening. Now, it's very common to believe that the only thing that causes gum disease is just that you're not brushing. However, there's a combination of things happening here. For example, you may have a genetic predisposition to it, or you may have a very aggressive bacteria damaging your mouth. On the other hand, when you brush and floss your gums and your teeth, you can only do so much. However, the bacteria can get deep inside your gums and it can do things that you have no way to control. Let me explain a little bit more about this, but let me show you something. So if you see here, this is how healthy gums should look like. Nice and pink, you brush them, they don't bleed. That's nice and healthy. When your gums start turning red and puffy, and you start brushing your teeth and you see blood coming from your gums, that does not mean you're doing a bad job. What does that mean is you have a problem on your gums, you have a disease. You have some bacteria that's breaking and damaging your gums. That's why it's making them so brittle, so puffy, and that's why you have some blood coming from there. Now, when the problem goes deep inside your gums, let's just say 3, 4, 5 millimeters deep inside the gum, at that point there's nothing that you can do to remove that bacteria that's getting deep inside your gums. At that stage, the gum disease is now turning into what is called periodontal disease. So now, we just established that issues with your gums, bleeding and all of that is gingivitis. However, if the bacteria goes deep inside your gums, the problem is a little bit more complex, and that's periodontitis. What can we do? The most important thing you have to do at home is brushing and flossing. We typically recommend brushing twice a day, but in most cases, twice a day is not enough. However, there's something else really important that I want to mention here. Every time you brush, every time you floss, you clean above the gum lines, and you can take care of the swollen gums, the puffy gums, and that can go away just with brushing and flossing. Now, there is a bigger problem here going on, and that's when the bacteria is going away from your reach. Once the bacteria is getting deep inside your gums, there's nothing that you can do to get rid of it, and that's when you need a professional taking care of removing that infection from you. That's why we recommend to see our patients at least twice a year, because we have to clean their teeth, but we also need to measure around the gums. We need to see what's going on. We need to see how bad this infection is. We do cleanings all the time, and a lot of people think a regular cleaning is more than enough, and it is most of the time. However, there's a point where this infection goes so deep inside your gums that regular cleaning is not gonna help you. Why? Well, because that regular cleaning is a superficial cleaning. It's a cleaning that you do here above the gum line. So when the dental hygienist or the dentist is doing your cleaning, a regular cleaning, honestly what we're doing is we're cleaning, we're polishing, we're removing all the bacteria, but that's the bacteria that's above the gum line. However, when the bacteria goes deep inside your gums, you have to do something else. You have to do what is called a deep cleaning. Why? Well, obviously that bacteria is deeper now. A superficial cleaning won't take care of it. You have to go deep inside your gums, 4 or 5 millimeters, and a professional has to use some instruments. They have to do some things, some techniques to get rid of that infection that now is in a point where it's away from your reach. So a lot of time people they feel judged. They feel like, oh, the dentist is telling me I have this problem because I'm not brushing fine, and that's not the case here. Unfortunately, this is a chronic disease. Just like people have diabetes or they have high blood pressure and nobody judged them, why would you judge somebody with periodontal disease? It's another chronic disease. And the same way you have to treat high blood pressure or you have to treat diabetes, you also have to treat periodontal disease. Why? Well, this disease is linked to other problems on your body. It can actually create Alzheimer, it can make diabetes worse, there is a link with this bacteria in the mouth and some endocarditis. So some things can happen here. Cleaning your teeth is not just for the sake of your teeth, it's also something you're doing for your overall health. So at this point we have to be very careful. We have to treat our patients with a lot of respect because they're suffering from something that they cannot control. But that's what we're here for. We're here to take care of you. We're here to get rid of that infection that you cannot clean. We're here to remove all of that bacteria that's going deep inside your mouth. And we're here to help you not only to keep your teeth nice and healthy and clean, not only we're gonna help your gums, not only we're gonna remove the bacteria that's causing all of this bad breath, we're also gonna have a huge impact on your overall health, because by removing this bacteria in your mouth, we're also gonna be removing a lot of infection from your body, and that's gonna have a huge impact on your overall health. Okay, everybody, I hope I was able to answer the most common questions about gum disease and the bleeding and all of that. If you have any further questions, all the information of our office is on the description below. Don't forget to like and subscribe. If you have any questions, please feel free to reach us, and we're more than happy to answer anything you want to know. So that's it for today. I hope to see you next time.